So lung cancer kills more people than all the other known cancers that we track. That includes breast cancer, colon cancer, prostate cancer. And these are all cancers that we have screening tests for. The important thing with all cancers, but very important with lung cancer, is getting to it early makes all the difference. Lots of times if we get to it early, we're able to treat and even cure that patient of cancer. Unfortunately, in the past, we've always gotten to the cancers too late. Not always, but often we got to the cancers too late. And by that point in time, we really don't have the option to cure the patient of cancer. So this lung screening has really revolutionized our treatment of lung cancer patients because it has allowed us to get to patients that often don't know that they have an early stage lung cancer. It allows us to get to them while we can still treat them. One of the big problems with lung cancer is that often it doesn't cause any symptoms at all. So the only way that you can detect these cancers is with some sort of imaging test, such as CT scan imaging. The patients often don't have any hemoptysis where they're coughing up blood. They don't have any pain. They don't know that they're sick until we're behind the 8 ball. And so that's why this test is so important, and it's so important to get to patients while we can still treat and cure them.
So if you're between the ages of 55 and 77, you probably qualify for a lung cancer screening if you have certain risk factors. The biggest risk factor here in West Virginia is smoking. So if you've smoked a pack a day for 30 years, or maybe 2 packs a day for 15 years, somewhere around in that range, you qualify for lung cancer screening. Patients that have quit smoking, if they've quit for 15 years, then that's when we can stop screening, or if you've gotten to the age of 77. So after meeting with your primary care doctor, you and he or she will meet to determine if you're a lung cancer screening candidate, if the test is right for you to have. The lung cancer screening test itself is a very easy test to do. It's a CAT scan. It doesn't require dye or IV. It takes about 15 minutes to do, and it's a low-dose CT scan, which means that it's about 1/10 of the radiation that a normal CT scan has.
So after they get that 15-minute test, essentially the radiologist looks at it, and they look for the nodules, as Dr. Ely mentioned, and what they do is they categorize it, and essentially they categorize it in one of 4 categories, any of these abnormal lung findings. 1's not that bad, 4 is more suspicious for lung cancer. Anybody that has any suspicion for finding a lung cancer then goes to a multidisciplinary discussion where we have pulmonologists, radiologists, and CT surgeons that all look at these nodules and help evaluate how concerned are we about these lesions, and then what should we do next. These next steps could include having a follow-up CT scan in a few months. It could include, hey, we have to get more advanced imaging, such as things called PET CT scans, or we may be concerned about these lesions enough that we say, hey, we have to progress towards surgery or some other way to get tissue diagnosis. So it really helps guide the patient whether they need any treatment, and then if they do need treatment, what path do we start them down.
So lung cancer screening is relatively new. We all know about breast cancer screening, colon cancer screening, and prostate cancer screening. However, lung cancer screening is something that just hasn't gotten a lot of attention. And so we urge you to, if you qualify and if you are a smoker between the ages of 55 and 77, to talk to your primary care doctor to see if you're a candidate for lung cancer screening today.